Dr. Kate Tulenko. She's founder and CEO of Corvus Health. That's a global health firm. Kate, looking at these numbers, they're small in comparison to places like the U.S., but in just over the last 2-week period, Xi'an has reported about 635 cases, all of whom were hospitalized. So how concerning is this?
Well, it shows that Omicron is much more infectious than Delta or the Alpha COVID. And I think we can expect to see more infections in China, even with these strict lockdowns. And we don't see a lot of very sick people with the Omicron. That's the good thing, that even though hospitalizations will rise, we probably won't see that many more people passing away.
What do you make of the spread? As you mentioned, it's not just located in Xi'an now, it's in 21 cities, 15 provinces and regions. Given what we know about Omicron, that sounds like it's spreading rather quickly.
Yes, exactly. We know that China has been vaccinating people because they've developed several different types of COVID vaccines and has been very strict with mask wearing. And even with those interventions in place, we are still seeing Omicron, spreading more and more. So I think that China will continue strict lockdowns. Some of the measures that they're doing, I don't think are necessary. For example, requiring people to keep their windows closed, or this spraying of streets and areas necessary, but certainly the other measures, such as the mask wearing, people staying home unless they have to go out to buy essentials or for an emergency, the social distancing, those are the things that are going to make a difference. And I think China is being extra careful now because in February they'll be hosting the Winter Olympics. And we know that the Japanese Summer Olympics that were held this summer actually were not a super spreader event, that Japan did a good job of containing it. I think China has learned a lot from the Japan Olympics. Now, there is a concern in winter. Infectious diseases tend to spread faster because the air is drier, but I think that China will be able to hold the Olympics without much of a problem.
I was just going to ask you, though, China's strategy, very different than some of the Western countries, just in its efforts to basically strangle outbreaks, isolate them. But given what we've seen here, that this looks like it's an imported case, it spread like crazy, what are the concerns leading up to the Olympics? And I know that they've got a lot of steps in place. Do you have any kind of fears about what might happen?
No, actually, I don't. For two reasons. One is how much China had learned from the Japanese Olympics, and China's very good at mass testing and has the adequate supply of vaccines, and also that I think that more of the athletes will be vaccinated now or will have already caught COVID, so they'll have antibodies. So I think on many levels, both the government of China and the athletes and their managers will be more prepared for this Olympics, even more prepared than they were for the Summer Olympics, which went pretty well.
Kate,
I'm not concerned.
Well, Kate, one final question before we let you go, and that's the question of shame. There was a piece, I think, in the Washington Post today about people who've just they've been so vigilant, taken all these steps, they wear their masks, they keep their distance, and still there's these breakthrough infections, as you well know, and a lot of people are feeling like, geez, I did all this stuff, and they're kind of ashamed. Talk to me about this other, I guess you'd say mental health piece of this, which we've seen so many different mental health pieces, but give me your thoughts on that.
Well, it's certainly understandable why people might feel ashamed or be disappointed, but in the end, we all have to just do the best that we can, and that when we get sick, we make sure we protect other people, and we handle it that way. So that really no one should feel ashamed or feel bad about getting infected, but they should take every measure to protect others as well.